Welcome to the Eating Disorder Recovery Podcast.
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 Welcome to the Eating Disorder Recovery Podcast with me, Dr. Janine Anderson. Heads up, this show may contain adult language and may mention specific foods. If you find either of those to be too triggering, I trust you to take care of yourself and do what you need to do. This podcast is sponsored by Ipono Maui and ED Care. Ipono Maui is led by internationally renowned expert on eating disorders, Dr. Anita Johnston. Located in a home-like oceanfront facility in beautiful Maui, Hawaii, Ipono offers residential, partial hospitalization, and intensive outpatient treatment for eating disorders. Visit iponomaui.com, spelled AIPONOMAUI, to learn more. ED Care has provided PHP, IOP, and outpatient treatment for all genders 18 and over since 2001. CAMSA, which stands for Connection, Acceptance, Mindfulness, Sense of Self, and Action, is ED Care's mindfulness-based treatment approach and is incorporated into each individualized treatment plan. Facilities are located in Denver, Colorado Springs, and Kansas City, and all treatment is supported by master's-level clinicians or higher. ED Care offers 4 specialty tracks for binge eating disorder, elite athletes, substance use, and trauma. And the Connections House, an affordable supportive housing component, adds an extra layer of supervised support. Visit eatingdisorder.care or call 866-771-0861. For the past 20 years, Quinn Nystrom has shared her story of living with type 1 diabetes to over 300,000 people across North America. As a National Diabetes Ambassador for Center for Change and a council member for the Minnesota Council of Disability, appointed by Minnesota Governor Mark Dayton, she brings a voice of hope and knowledge to the millions of people living with the disease. Quinn is an accomplished writer and author of If I Kiss You, Will I Get Diabetes?, a first-hand account of negotiating life with chronic illness, and lauded as a must-have book for parents, educators, and healthcare professionals in understanding a teen's perspective on living with diabetes.
Quinn Nystrom, thanks for being here. So introduce yourself to the audience. What is your role at Center for Change?
So my name is Quinn Nystrom. I was born and raised and still live in Minnesota, and I'm the National Diabetes Ambassador for Center for Change. So this last year I've gotten to go around the country and really talk and I think bring a larger light to the topic about having type 1 diabetes and an eating disorder and how prevalent of an issue that really is. And really how lucky I feel that there's a place that you can send people, because that is a complicated relationship of having both of those illnesses. So I've gotten to go around and talk with Dr. Barrett and talk in front of diabetes groups about why there is such an issue and why we need to talk about it instead of, I think sometimes in the diabetes community we've hidden from it. And there's been a lot of, I think, misconceptions about the two illnesses.
Right. Tell us a little bit about the diabetes program at Center for Change specifically, because you guys have an amazing program there.
Mm-hmm. So, again, I'm not a clinician, so I won't speak to the specifics of that. But what I really respect about Center for Change, and, I learned about their program last year, is with a typical sort of eating disorder treatment, right, for a patient that's going in. It's very different if you have a type 1 diabetes patient come in for an eating disorder treatment, right? Because the two kind of work against each other. In eating disorder treatment, you sort of tell people, let's not talk about food, let's not talk about sugar content, carbs, right? With a type 1 diabetic, we have to do that every single day for every single meal, right? And so the two really work against each other. And so Center for Change has put together, in my opinion, an all-star team specifically to treat people with EDDMT1, right? So they have a phenomenal endocrinologist. They have a phenomenal physician's assistant, nutritionist, dietitian. I mean, it's a comprehensive team that's devoted specifically to treat patients with both of those. And I think that's critical because if a team doesn't understand how those two work together or work against each other, it can be very detrimental to a patient who's gotten to that point where they want recovery, they want help, they want assistance to try to treat the two.
Right.
And so there's not a lot of places in our country that can treat that and treat it as well as Center for Change has. So that's why I'm honored to get to go around and talk on behalf of them and that program to hopefully get more people to get the help that they need and deserve.
Yeah, definitely. Tell us a little bit about how prevalent of an issue it is, or for people who aren't familiar with the diabetes community and the overlay and the eating disorder community as well.
Yeah, I mean, we have a lot more research now on it, right, than we have, I think, ever before. I think the recent statistic I've seen is a young female with type 1 diabetes is 2.5 times more at risk of having an eating disorder than just a regular, teenage girl. And so it's a much higher prevalence, but I think sometimes it gets confused in the diabetes community as being a non-compliant patient, right? And I think we see, at least from, I'll say my purview as somebody who's lived with type 1 for 18 years now, that the way that it's sometimes talked about is sort of either in slang terminology like diabulimia, right, which is not the medical diagnosis.
Right.
It's a pithy sort of name, I guess, to call it, but not everybody with type 1 diabetes and an eating disorder just restricted their insulin and shot up their blood sugars. Right. There's several different symptom usages that people could have used.
Right.
And so I think there's some people in the diabetes community that, again, they think just take your insulin, be a more compliant patient. And I think it's inhibited people from saying they have a problem or they have an issue and that they need help because there's so much shame with it. Right?
Tell us a little bit about your own story, both your diabetes diagnosis and recovery.
So my earliest memories of struggling with an eating disorder was around 11 or 12 years old. I come from northern Minnesota where everybody probably learns to skate at 2 on the lake in their backyard. And so I was a competitive figure skater. And so I remember when I started competing at 10, right, of really looking at my body and my weight and food and feeling very self-conscious and having that pressure, right, to lose weight, to feel like you could be better at a sport. And so my parents brought me in at the time to a pediatrician after a school nurse had called my parents saying, I wasn't eating regularly, I wasn't eating the lunches. And this pediatrician just kind of said, well, just make sure she eats breakfast and dinner, right? Just kind of, she has an issue, but just make sure she's eating dinner. Well, and I think he meant well. He just didn't have probably the insight
to realize that was significant.
That it was significant and that it was a major problem. And I think, so then about a year and a half later, I was back in that doctor's office, but now it was because I was being diagnosed with type 1 diabetes. And I was 13 years old. I was in the 7th grade. And I think anybody who's been a 13-year-old girl, maybe even a boy, I don't know, but all you want to do is fit in. You want to blend in, right? I want to look like everybody. I want to talk like everybody. I want to act like everybody. I want to buy the same shoes as all my friends. And now you're being told you have an incurable chronic illness. For the rest of your life, you're going to have to monitor every single thing that goes into your mouth. You're going to have to test your blood sugar multiple times a day. You're going to have to take multiple insulin injections a day just to stay alive, or wear an insulin pump. And then this doctor said to me, which at the time I thought was awful, but I've later heard that this has happened to a lot of people. Right when you're diagnosed with type 1 diabetes, oftentimes you've lost a significant amount of weight, right? Because you don't have the insulin, your pancreas is shut down, and so your blood sugars have been so high for so long.
Right.
So you're losing a large amount of weight.
Which is not good.
It's not good.
Not good. Right.
It's not good at all, and you're very sick.
Right.
Well, the doctor immediately says to me when he's diagnosing me, oh, don't worry, Quinn. As soon as you start taking insulin, all the weight will come back.
Oh, and all the eating disorder just raged.
Right. It just, and so you get this automatic connection as a 13-year-old girl. I'm going to now equate insulin and my diagnosis of type 1 diabetes, which I had nothing to do with, right, because it's an autoimmune disease, it equals fat. It equals me gaining weight, me not being able to fit in and blend in as a 13-year-old girl.
Yeah.
Right? And so there's this fear and this, I think, very complicated relationship that starts right out of the gate. Right? I don't think any 13-year-old girl wants to be told that.
I'm sure.
By a doctor.
Let alone the thing that you have to do to stay alive again and again and again and again.
Yeah.
Not using insulin is not an option.
It's not an option.
Right.
And again, if you do utilize that option, you become very, very ill, and your risk of dying quite quickly increases dramatically. Right? And so, you know, for me then, I think my parents were so focused on the diabetes diagnosis that the eating disorder thought just sort of, I think, left their mind. Where then my mother, and I think she had the best intentions, a couple years after that said something to the effect of like, it's almost like God blessed you with having diabetes because now you have to eat regularly. You know, like the eating disorder was sort of cured.
Oh, but for you, what did it actually feel like? Because I'm sure that didn't feel like being cured.
It didn't at all. And what I thought is it just made me be more secretive, right, of sort of this eating disorder that became much more hidden, right? And sort of it went from what started as anorexia to really a full-blown bulimia for me in any way that I could figure it out, right, without raising any red flags, without having people think less than me, that I was, and I think for me, maybe that was, I don't know, in my mind, you know, insulin restriction was never a primary symptom for me. And I don't know if that's because then at 16, I was sort of thrust into this sort of public world of being the national youth advocate for the American Diabetes Association. So now I was flying all over the country, to the White House, to the U.S. Capitol. I was talking to all these diabetes groups, and in the diabetes world, you're praised when you have good blood sugars, when you eat good food, quote unquote, right? You are not praised if you take a dessert, right? If it looks like I'm not testing my blood sugar, and so the sort of good and bad is set up right away.
Yeah, lots and lots of rules, because there is reality to that you have to kind of manage the range for your blood sugar, but then it can be really easy to be rigid about that.
Very rigid. And then for me, it was like, oh, because these are the rules, I would just use the diabetes as like my get out of jail pass. So if I was at a dinner and I didn't want to eat bread, if I didn't want the pasta, if I didn't want the dessert, right? Really, it was the eating disorder saying it, but I just say to the table, oh, I have diabetes. And of course everybody would say, oh, of course, you're such a good diabetic. Right?
Goodness.
And so then I'd be praised for what my eating disorder was telling me to do. Because I didn't want that criticism that I knew I'd get when I grabbed for a dessert from people who didn't fully understand diabetes, I'll say.
Right. So from the outside, it looked like you were being a, quote, good diabetic.
Of course.
When really this was a lot of eating disorder behaviors going on.
Of course. I think it just continued to flare. And this thought again that though I struggled because I wanted to be this sort of quote unquote perfect diabetic, which that's not a thing, right? But that's what I wanted. I wanted to appear like that as this national spokesperson for the Diabetes Association. But then it was this constant thought of this physician when I was diagnosed saying, you want to be a good diabetic? You're going to become overweight, right? I mean, that's how I interpreted it as this 13-year-old girl.
Right.
And so it was then trying to figure out, it was in a way, I guess I felt entitled or like I deserved or that I got to cut corners, right? Because I was given this sort of lot and now I'm just it's just harder for me to lose weight than my friends. Right? And so I think I just made those excuses.
Sure.
And just never got help or treatment for years.
What did put you at the place where you said, okay, this is a problem and I need to get help?
I wish that I had some great story that it was like, that it was myself pulling myself up from my bootstraps and having this like aha moment. To tell you the truth, I was in my annual OBGYN appointment. First time I ever met this physician. And again, I went to great endocrinologists my whole life in Minnesota. They never flagged the eating disorder. I was never asked about it. So here I was then at this OBGYN appointment at the age of 24, living in Minneapolis, and she was just asking me my history and, saw that my weight had yo-yoed significantly. And so when she kind of pressed me on it, I gave her sort of my patty answer, which was, I have type 1 diabetes. I really try to control my weight. It's just a struggle for me. And so she kept pushing me on it. And I think, again, because I just justified in my own mind that what I was doing was okay, that like I was allowed to do that because I was diagnosed with type 1 at 13. I didn't think she was trying to find something out about me. And so she said, I really think, Quinn, it would be good if you spoke to somebody. I don't think it's healthy to go up and down significantly in your weight. She said, would you be willing to at least speak with somebody? And so she referred me, to an eating disorder treatment center where, I did an intake. And I still was kind of surprised at why I was even there.
Did you identify as having an eating disorder at that point?
No, I think because people around me, like my family, they thought like the diabetes sort of wiped out the eating disorder. And so I think in my own mind at that point, I was so delusional, really, that I was allowed to cut these little corners that I did, right, with behaviors. And because in the diabetes world, as a national speaker, right, for the last 14 years, I never heard people talk about it unless they used it in terms of diabulimia and insulin restriction.
Right.
And so because I didn't relate to that 100%, I thought, well,
I don't have that.
I don't have it, right? Like, I don't have it. So when I went into this intake, I sort of was like, oh, maybe they can give me some tips or ideas. I don't know if I thought I was seeing a dietitian. Like, I was just clueless. But I went. It was the week before Thanksgiving. And they asked, obviously, very in-depth questions.
I'm sure.
Very in-depth, where I'm just like, oh, get me out of here. It was, 2-3 hours. I didn't know what she was going to say. I just thought, like, I was going to get some nutrition tips. And I was like, wow, this isn't in-depth. I've never done an intake. And so they brought me through the ringer. I think I was relieved at the end, thinking, like, okay. And so they came in, and diagnosed me with bulimia, and I think I was just shell-shocked.
Sure.
I didn't know. But again, I think the blessing of it was then starting, and I started in outpatient treatment, but that was clearly just like skimming the surface of what the issues were, right? And I think going into treatment, clearly it saved my life, but it took several years after that to fully grasp what the eating disorder was for me and how many parts of my life it had taken over.
Will you tell us about that?
Yeah, so I started in an outpatient, and I was in a group, with people with type 1 diabetes and eating disorder. And I think that group almost single-handedly helped change kind of the path that I was on, because maybe they were able to be more like truth tellers to you because they'd sort of been there, done that. And I also saw other people with type 1 diabetes and eating disorder that it was more than just insulin manipulation to them,
right?
As a symptom. And so that helped me to be able to sort of peel back what the issues were, right? If that was using my diabetes diagnosis as a crutch not to eat things if I didn't want, if that was for me then to over-exercise, if it was, whenever I got a low blood sugar, knowing that I should treat it with 15 to 30 grams of carbs, but over-treating it, and it would always go to a binge. And then the guilt that I would feel from not being a good diabetic because I've way over-treated that, right?
Gosh.
That then would spin me into restriction, right? And the cycle would just continue.
Sure.
And so I think being able to sort of look at yourself with a mirror in this group, to see some major issues that I was struggling with is what then ultimately got me to go into inpatient, which then in turn, the following year was back in inpatient and then went to residential treatment out of state for 3 months, and then did sort of a step down sort of halfway house so that I could really be removed from my environment to see, my perfectionism that I struggled with, my thoughts about myself, my thoughts about eating disorders, my thoughts about, I don't want to tell anybody I have an eating disorder because they won't believe me because I'm not underweight, right?
That's horrible. I hear that all the time.
Yeah, I mean, I struggled to, I talk to a lot of people now about getting diagnosed with type 1 diabetes. You can kind of tell people, like, it's an autoimmune disease. I was diagnosed at 13. Most people are very sympathetic, right? You tell people you're diagnosed with an eating disorder, and oftentimes it's this very awkward pause, right? Either people don't know what to say, or sometimes they'll say, hopefully just go to treatment once and it's like it'll be fixed. Right?
Yeah. I mean, that's great if that happens, but that's not the case for a lot of people.
Yeah, and I think also, the component of family therapy, right? I was the one who chose eventually to go to treatment, not my family. And some people in your family are more apt to want to participate. And some people it's difficult because you're bringing up a lot of issues, right? And family dynamics. And I think that's really tough. And I think also for me, I never grieved the loss of my pancreas shutting down at 13, right? I think my little brother had been diagnosed 2.5 years before me at 5. And they had, put him into the hospital. He was there for a week. He was this 5-year-old little boy. Everybody grieved. It was this whole process. And then when I was diagnosed, my only question to the doctor was, can I go to the junior high dance tonight? I think I just thought, okay, let's hop back up and get back to life. But I hadn't been able to grieve and to process that loss.
Right.
And I think eventually going to residential treatment, getting away from, I'll say, Minnesota, where that's home for me, it was a life-saving thing for me.
What was it like when you went to inpatient and residential? Because I know that those are really scary levels of care for most people to start. And I think starting treatment at a higher level of care especially is just terrifying for everybody. What was it like for you?
Yeah, I think I'm probably no different than, it was very difficult for me because, again, I think I had sort of created this life that seemed like I had everything together. I owned my own home. I had a great career in sales. And now I was going to have to take off time from work, with disability. I was going to have to tell my family. But that final time that I went, what pushed me to finally say, I can't do this life anymore. Like, I just can't keep, like, switching all these masks on and off and, saying I don't have problems, I have hobbies. It's like I couldn't do it. I was exhausted. And I went to a funeral of a girl who had been in my group, my eating disorder, type 1 diabetes group. And at her funeral, I just thought, I don't want my life to be like this. We're too young.
Oh my gosh.
Right? And so it set me on this path of saying, what can I do to help myself? Right? And I think it was having a little bit of hope that my life could be different. Right? And my own personal faith of knowing that I believed there was a life out there that was better than the one that I was living.
Yeah.
Right? And holding on to that as tight as I could, and also learning to what voices do I listen to around me, right? Because there were people in my inner circle who thought, why would you have to go? You're just fine. You're not that sick, right?
Yeah, I mean, just for the record, for people who are going to listen to this episode, eating disorder treatment centers don't recommend higher level of care for no reason. So if they're recommending that to you, it's because that's warranted. Mm-hmm. Even if those people in your inner circle don't get that.
And I think it was learning then of having a smaller group around you, but a group that was going to stand by you and support you, even if they didn't understand the complexities of eating disorders and diabetes or mental illness as a whole. They wanted me to get better, and they were going to do what they could to help me get better. Mm-hmm. And those are the people that I wanted around me, and the voices that I listened to, right? And the only reason, I guess, why I ended up ever speaking publicly about eating disorders was really two things. One, I mean, my frustration that I saw in the diabetes community of not wanting to talk about eating disorders and this high prevalence because there was a thought that it would give people ideas, right? Which I obviously believe is completely false. Second, when I finally got to residential treatment, I was ready to get help. On day 6, the insurance person came in and said, your insurance isn't going to cover it. They were in network. I called ahead of time, right? They had never not covered anything. They always covered inpatient, everything else. And I never thought that they would reject the claim. And so they said, okay, you're on day 6, you owe a couple $1,000.
Wow. So
you either have to pay up, prepay moving forward, or you gotta get on
right.
Get on a plane and go home, Gosh. And because I hadn't asked for my parents' approval, because it was my insurance, my employer, I had to call them and say, they knew I was going, but I had to call then, and with the help of my therapist then, for the first time in my life, sort of be brutally honest to my parents about what issues I was facing. Not pretend.
They didn't understand what the profundity or the gravity of the situation was?
No.
Not at all? Okay.
No, and again, they're great people. I come from a wonderful family, but I think mental illness is just confusing to a lot of people, right?
Sure.
And I think because I had worked my whole life to have this mask on to my family, that I was sort of the compliant middle child. I was a striver. I was an achiever.
I mean, you're like the youth advocate for
diabetes
nationally.
Right?
Yeah.
I'm going to the White House. I'm sitting with, the Speaker of the House.
Right.
I think my parents thought, oh, she's so great. So, for then me to say, I'm sick, right? And to be very honest about traumas that had happened in my past that I had never spoken to them about, right? And to say, I'm fighting for my life and I'm ready to get help. But I don't have the money.
Yeah.
And my insurance company doesn't think I'm sick enough. Right? And so they stepped in and said, okay, right? We wouldn't second guess that if it was something with diabetes, right? We're going to listen to the people who are there saying, you need to be there.
This, yeah.
Right? And and that is what saved my life, right? Was those 6 months or 7 months of going away. That is what definitely saved my life. And so after that, when I was, actively in recovery, I ended up hiring an attorney to sue my health insurance company and my former employer, because my diabetes advocacy background told me if something is wrong, you stand up and you tell people that was wrong.
Wow, that's amazing. Yeah, good for you for doing that.
So, and I thought there's such a double standard.
There is.
Right, with my type 1 diabetes, if I go to the hospital, if I, for the most part, they always cover it. They don't say, oh, no, you're not diabetic enough. Right? Like, you're not sick enough with your diabetes.
Yeah.
And so it just peeved me to no end that a health insurance company who misspelled my name, I think actually one of my letters said Mr. Quinn Nystrom. They thought I was a man, who they didn't even talk to you, are sitting in this, far away office. Right. And they've said, no, she doesn't need treatment. Right. She's not homicidal or suicidal. Right?
Yeah.
And And so it was so frustrating that I thought, we have to do something about it. And I knew the attorney that I hired, who took it on pro bono, she said, this is very difficult to do. Mm-hmm. The system can kind of be set up against you. But, and long story short, we lost. We lost the case. But the health insurance company had to pay more money for an attorney than they would have just paid to settle. Right?
Oh my gosh, that's ridiculous.
But I think to show them that people are going to stand up.
Yeah, that's great.
And to strengthen our voice. And my thought then after that came down was, can I go around and use my platform in the diabetes world to speak out about what I believe was a much higher prevalence of people struggling with type 1 diabetes and an eating disorder.
Yeah. I guess kind of backing up for a minute, what was it like to be away from your life for 6 or 7 months? I feel like people don't talk about that enough, and a lot of people do higher level of care for a while.
Looking back on it, and maybe because now I can retrospectively look back, it is what saved my life. And so I look at that as such a blessing that time. But I'll tell you, when I was being picked up at the airport by the treatment center, I think if the doors hadn't been locked, I would have ejected myself out of the passenger van. I think I was so frightened, right? And that my computer was going to be taken away. My phone was going to be taken away. I remember literally being at baggage claim, as I'm waiting for my bags, typing work emails, and the passenger driver's calling, where are you? We're picking you up. We're checking you in. I'm just just ferociously typing these emails out and trying to make all the calls I can. And you don't really know, well, do I want to tell people? I don't even know how long I'll be here, right? Because you don't know when you're checking in, how long they're going to say that you should be gone.
Sure.
And so it's this, I think especially, right, in 2017, we're so used to being on our computers, on our cell phones, on social media. And so you're I can't do this life without an iPhone,
Yep.
And you want me to call on a landline phone? I don't even know anybody's phone numbers.
Right.
How are they going to, right? I'm I got to write down everybody's phone numbers before I get there, right? So I'm just ferociously, writing down, And so I think you're just so scared of what is going to happen at this mysterious castle, locked castle you're going into. But again, I think the greatest thing for me was because I had done inpatient treatment in Minnesota, and I kept going inpatient, going on all the outpatient, levels of care, and it just wasn't sticking for me. And so for me, it was, okay, let's try something different, which was leaving the state, leaving where friends and family could visit me every single night. I was in a program there where I could have my phone and computer. So of course, what was I doing? I was on my phone and computer, right? So to be at a place then where I literally had to face my own demons and issues head on, and I was in the safe environment.
Yeah.
Right? Being around all women and having great providers to really help me see what the issues were. Mm-hmm. I don't think I would have been able to uncover what I did if I wasn't in this very sort of isolated environment, if that makes sense.
Excuse me. Yeah. So for somebody listening out there who's considering going to higher level of care, maybe even out of state, and they know this might be a while away, what would you say to them?
One, I would say, I think going into it, you think, oh my gosh, my life is over. This is taking up so much time. My job isn't going to be there. My friends aren't going to be there. I will say when I got back 7 months after leaving, every single person who mattered in my life was standing right there. Every person that mattered was writing me letters when I was in treatment. Right? They can see, you can still get snail mail. And also I think too, when you look at your life retrospectively, it was such a short amount of time. And there's some days where I actually sort of like look at that like very positively of when I was there. Like, my life is so crazy now. Like, you know, I try to stick to my meals and my snacks and my blood sugars and I'm flying here or going here. I have this work deadline. Where in a way I look at that time and think I'm so grateful, right? That for whatever that was in me that said, I deserve this better life, I'm going to take this time. It was the best investment I could for myself and for my family and for my friends, right? And I remember a family therapy session with my little brother, and he said to me on the call, he said, this is the first time that I've seen you or heard from you, Quinn, talking about what you really struggle with. Oh. Right? And he said, I hope you don't ever feel like you have to go back to that place of pretending. Oh. Right? And I look at that and I think it wasn't just for me, it was for my own relationships with family, with friends, with coworkers, to find an authentic self. Right? So...
And you made it okay to be real about having problems and to talk about that with your family.
And I think once you do that, right, you give people an opportunity to also say what their struggles are. Yeah. Right? Because, okay, so my pancreas broke down and I have an eating disorder. Okay, like what's your issue? You know, like, I think you learn, like, you can fantasize about whoever else's life you think is perfect, but it's not. Everybody has a cross to bear, right? And so for me, it was the quicker I could figure out what I was struggling with and the quicker I could figure out resources or this new, you know, working CBT or DBT of, okay, what can I do, right? A healthier skill set instead of going to symptoms, right, to deal with things that still happen to me today. It's not like my type 1 diabetes is cured. But what can I do to set myself up for this healthier life? I think it was liberating. It was very freeing. I felt sort of like a coming out party, like after I left, you know, because I thought, okay, like this is it.
Yeah, it's okay to bring it all.
It's okay to bring it all. And I'll say, and I know I've talked to a lot of people about this at Center for Change and at these speeches, I was so shocked because I felt that maybe like other people, like I'm the only person in the world who's struggling with this, right? You think you're all by yourself. You know, you're the only person on the 7 billion people who are going through this, which is kind of narcissistic, I guess. But I guess that would be another treatment center. No. That when I decided then after losing that court case to speak about it for the first time at it was a Students with Diabetes conference down in Tampa. And it was a breakout session that I was going to talk about it. And again, never spoke about eating disorders. Didn't really, I thought that's not what I signed up for. But I thought, okay, I'm just going to do this one time. And it was a breakout session, and we were competing with, I think, sex, drugs, rock and roll, and diabetes. So I thought, well, this is definitely not the sexiest session that's being offered, right, as a breakout. And the room was packed, right? And what it showed me was the high prevalence and how many people in the diabetes community struggle, either with disordered eating or an eating disorder or body image issues. Yeah. And it really is what propelled me then now a couple years later, you know, to get an amazing opportunity with the Center for Change to get a platform to talk more about it, because I know there are so many people struggling with it.
Right. What are some of the misconceptions or misunderstandings that people have about DMT1 and also having an eating disorder?
I find that the biggest misconception is maybe people in the diabetes community or just the general healthcare community, they view it as a compliance issue, right? So somebody has type 1 diabetes, and I'll just say with insulin restriction, okay? So they see a super high A1C. They believe their patient is not being compliant, right? And so they think they're being a bad patient. They're not taking their insulin, right? And so I think when you're diagnosed with type 1 diabetes at such a young age, you are just inundated with people sort of just judging, like good, bad, good number, bad number, good weight, bad weight, right? And so now you're sort of being hit with it again. where I think if people could step back and see why is there a higher prevalence, right, of people who struggle with both of these. On a weekly basis, right, I get people who say, oh, you shouldn't be eating that, Quinn, right? Or I actually take screenshots on my phone all the time on Facebook of people talking about whatever diet thing they're selling, that they can cure diabetes. Or that if I ate 5 lemons, I'd cure diabetes. If I ate cinnamon, I'd cure diabetes, right? And so if I drank fill in the blank from whatever distributor, I would cure my diabetes, right? And so this thought about being thin, being healthy, right, will make you somebody good with diabetes. And then, again, to that note, you won't have an eating disorder, right, because they think it's a compliance issue. So I think that's like misconception number one. And I think number two, which is something that I've always struggled with and I think prohibited me from getting help sooner, was that because what I always heard was diabulimia, insulin restriction, double-digit A1C, that's all I thought then it was, right? I didn't realize at the time, right, that what a lot of people in the eating disorder healthcare community called it was ED-DMT1, and that was an umbrella for several different types of symptom usage, right, of how your diabetes connected to the eating disorder, which was much more true for me, but I actually never even heard of that prior to going into treatment.
I feel like even as a professional, people are still shifting out of saying diabulimia and thinking only about diabulimia to ED-DMT1 or DMT2. And I would say we haven't even clarified the difference between type 1 and type 2, so I don't know, maybe we should do that really quick too. So you have type 1. Yeah, so I have type 1 diabetes, and so there's about 29 million Americans with diabetes, okay? Roughly 5 to 10% have type 1. Type 1, primarily you're diagnosed usually under the age of 21, typically. Majority of people are diagnosed before 15 with type 1 diabetes. It's an autoimmune disease, sort of in layman terms, because I'm not a medical professional, your pancreas shuts down, stops producing insulin. So people with type 1 diabetes, that's why they have to test their blood sugar multiple times a day. They have to give themselves insulin because you're mimicking being the pancreas. They don't know, you can't prevent it, I can't cure it, right? So people can stop sending me private messages about buying their products, it'll cure it. You can't. Oh my goodness. Type 2 diabetes is more prevalent, right? It makes up 95% of Americans with diabetes. But with type 2, your pancreas still produces insulin, but you have an insulin absorption issue, right? Now, again, I think people then automatically want to shame type 2 people because they say, well, it was your fault. But the thing with type 2 diabetes is, first of all, not every single person in our country who's overweight has type 2 diabetes. So it's not a direct correlation. There's about 7 different risk factors for type 2 diabetes: ethnicity, age, family history, certainly activity and lifestyle play into it, but it's not the sole criteria. So I always try to tell people that. Also, you can't cure yourself from type 2 diabetes. If you're diagnosed with type 2 diabetes, oftentimes, they'll put you on a diet and exercise plan first to see if, the insulin absorption will get better. If not, you go to oral meds. If not, you go to shots. If you take shots as a type 2, that doesn't make you a type 1. That's another misconception. You're still a type 2. And if they can, work to, if it is a weight issue and they can go off insulin, they can go off their pills, it doesn't mean they've cured it. They just don't need medication to manage their type 2 diabetes, right? But I think type 1 and type 2, there's a lot of shame and blaming, I think, that our society as a whole has put on people with diabetes. I totally agree. I think in general, people overestimate how much they can control about their health. And of course, I think it's helpful for us to try to take good care of our health and to do what we can.
Absolutely.
You don't have absolute control over what your body's going to do.
I always say to people, if I could pay $19.99 and take some cinnamon capsules, don't you think I would have done that by now? I don't think anybody wants to have diabetes. I don't think people want to take insulin shots, numerous times a day, right? So if there was something that could cure it, I think all of us would have.
Right.
So, I think diabetes is a huge issue. And I think something that a lot of people with type 1 specifically struggle with is it's a very serious disease that has to be managed every hour of every day, right? I can't come and do this podcast without bringing a bag of all my insulin supplies, right, of glucose gel in case I go low, right, I have my blood sugar on my Apple Watch. I can't just sort of be this free-spirited person, just go wherever and just not bring my stuff.
Yeah.
So it's this, very serious sort of things you have to do every day. But we look like everybody else, right? So people don't sort of think of you as being very sick, right? Or having to hourly manage a disease.
Right.
Because I look like anybody else in the room.
Right. And I don't think many people can get that. It's consistent, ongoing management forever if they don't have to do something like that themselves.
No,
myself included.
Well, yeah, and I think, there's so much more research that's come out, especially on anxiety and depression with people with diabetes. And again, such a higher prevalence. And you can see it. If you were given this chronic incurable illness at a young age, you didn't get a choice in getting it, and now you are forced for the rest of your life to try to, you individually, because the management of your disease, about 95% of it is you, right? I don't want to be a doctor, but now I'm having to dose insulin to keep myself alive, right? So I think there's a frustration and also this concept of diabetes burnout that is very real to people. And very, I interviewed Nick Jonas for a blog that I write for a diabetes website. And, here he's, this mega superstar. Like, you think his life is just perfect. Well, he got diagnosed with type 1 diabetes, as a teenage guy. And he said the worst part about having diabetes is all the questions, like sort of the dumb questions people ask you when he just wants to sit at a meeting with other people and not be excluded or called out. Right.
That it's part of his life, obviously.
Yeah.
But that's not the whole of who he is, and probably not what he wants to talk about most moments.
No, you don't want to constantly, anytime you sit down for a meal or if you decide to take, your insulin at a meal, you don't want people to say, oh my gosh, I could never take a shot. I just hate needles. And you're like, oh yeah, I love them. Yes, I just love injecting myself. So it's, I think just that exhaustion that just wears on you. Or again, even if you don't have an eating disorder, I think a lot of people with diabetes struggle with anxiety and depression. A lot.
What kind of advice or tips would you offer to people who do have diabetes, type 1 or type 2, and are also struggling with body image, disordered eating, maybe an eating disorder, so that they could advocate for themselves?
I'm a big advocate of making sure that patients with diabetes know that as the patient, you're the boss, right? You're the boss, you're the paying customer.
We work for you.
Right?
Yeah.
It sounds to me, right? I'm talking to you as a provider.
Oh, no. I totally mean that seriously.
But what I think inhibits people from sometimes getting help or getting treatment is they have a provider who doesn't listen to them, they don't take their concerns seriously, or they have shamed and blamed them at every appointment. So now either they don't go, right, to their endocrinology annual appointments, or maybe they just go to a regular provider, right, to get their insulin prescription. But if you're going to somebody who you don't think is up to date on diabetes in 2017, right? Find another provider, and now I think the amazing thing with social media is there are all these groups on Facebook, just free groups, or that you can just go and post a question. Like when my little brother moved to Denver, I wrote on a Facebook group, like, my little brother who has type 1 just moved to Denver, what endocrinologists and diabetes nurse educators would you recommend?
Wow, that's awesome.
Right? Yeah. And you just get a flood of answers, and it's from real people who live with it, who as patients, I think, what you're looking for in a physician is somebody who's knowledgeable and up to date and compassionate. And lastly, is a coach. They're not a dictator. They're not a shamer. They're not a blamer. They're a coach. They understand that, like, you're the one who's running the ball and running the plays 95% of the time, right? You maybe see them 4 times a year, maybe. So to have somebody who's going to just give you ideas, and then for you ultimately to be the one who makes that decision and to feel empowered as a patient. Because I think when people with diabetes who struggle with an eating disorder or body image issues go to somebody they trust, right? They're going to be much more apt to open up about things they're struggling with. And also, hopefully, if that provider is up to date with their knowledge, they also know the higher prevalence of people with diabetes who are struggling with eating disorders. So they know where to refer them. They know where to send them to so that they can get the best help possible. You know, that they don't just say, you're a bad diabetic because you're terrible A1C. Because that is the worst thing that they can do.
Right. Shame doesn't get us anywhere.
It doesn't. I think it does not motivate people.
No, there's research that backs that up now.
It does.
I wish we could all stop shaming other people.
I know.
So now we know that.
Nobody, you know, and like my endocrinologist, he says, Quinn, every single patient, I can come up with at least one genuine compliment. Right? That's not very hard for me. Right? And so I think finding a provider who is going to be positive, who's going to give you good resources or good recommendations, and actually care about you as a person. Because I think when that happens, then I won't feel judged when I'm going to say something that maybe somebody else would say, oh no, you're not doing it well. You're not doing it right. If I'm in that office, I've done a good job. Right? Because I'm alive and I've managed it up to this part. No matter what that number is. And so I hope that people with diabetes will realize, like, it is a serious issue and they're not the only person in the world who's struggling with it.
Absolutely.
Right? And it's okay to talk about it, right? To people you trust. You don't have to be on a podcast of however many people who are going to listen, to me telling my personal story. But I think there's a power in releasing those secrets, right? And that will set you free. Like I believe that it did for me in my journey of finding recovery.
Yeah, I think you have to be honest if you're going to recover.
Yes.
And sometimes people like myself take their time with that and do that like bit by bit until you learn to just be fully, unflinchingly honest, but you got to get there at some point.
Yeah, and I think too, I remember a therapist years ago saying, Quinn, you don't have to tell your story to everybody or every single piece of that story to every single person. Like that person has to earn the right, for you to tell them, right? A deeply personal thing that you've held so close to your chest for so long. And again, I think it's learning of like, who do I sort of hand this like megaphone over to, right? That I'm listening to, of their thoughts, their opinions. At the end of the day, I think it's holding true to what you believe, and this knowing that people struggle with it and there are places where you can go to get help.
Absolutely. And when I put together the show notes for this, we'll have a bunch of different links for resources where people can go. If people want to connect with you on social, which I'll also link to, what are your handles?
Yeah, so it's just on Facebook, Twitter, Instagram. It's just my first and my last name, so Quinn Nystrom.
And it's Quinn with 2 N's.
Yep, and then my last name starts with an N, so there's 3 N's in a row. Okay. But so they can find me and like on my website, QuinnNystrom.com. I have all my blogs. I write for Center for Change every month. I write for National Diabetes blog about just life with diabetes and an eating disorder, and so they can get that there, and my email's there. And I encourage if anybody has questions or, just wants to reach out.
People are going to write you.
Yeah.
Yeah.
But I honestly, I look at it like, Dr. Barrett said, I think it's a blessing when you can come out of something on the other side and want to then use it to try to help people. Right? And in any small way that you can.
Yeah.
So.
Well, thanks for talking to us. Again, I will link to everything in the show notes so people can find you and find resources and all of that. Thank you so much.
Great. Thank you so much for having me. I appreciate it.
Of course.
Thanks for joining me for another episode. Let's keep in touch. You can find all the information you need about the podcast at eatingdisorderrecoverypodcast.com, including full podcast episodes and links to all of our social media sites. You can join our Facebook group for the podcast by searching Eating Disorder Recovery Podcast on Facebook. This is a closed group for listeners of the podcast looking to connect, share resources, and get involved in a pro-recovery community. Don't forget to subscribe to the podcast on iTunes, Stitcher, SoundCloud, or YouTube. Please leave us a review and let us know how we're doing. Talk to you next time on the Eating Disorder Recovery Podcast.